We're so excited to officially be launching our 2025 Food Security and Community Health Fund. And every year, of course, we have a holiday fundraiser and a theme that we work with to share with our community. And it spotlights our real passion for humanitarian impact, and here at our center at HI in Cameroon, West Africa. Food security has been a topic that has been very much on your mind for many years now. And this 2025 fund is linked to what we've already been working with. It's a deepening of our efforts in Cameroon for food security, for community health. Why is this topic so close to your heart? And why are we continuing to work with this theme?
Let me tell you, there is 50-year-long wisdom in it. We have been in this business of share, serve, care, and grow mutually. For last 50 years, we have been in this business. And we have seen a consistent pattern. We started with eye hospital in early 1970s. We started helping and serving leper colonies in India. We established library that was needed for a degree college to become a university in the Himalayas. We established Himalayan Institute Hospital as well as medical college. Then and this happened in matter of 15, 17 years time, maybe 20 years time. Then one day, exactly maybe little bit more than, or maybe somewhere in the range of 20 years ago, we were there in Uganda. There we saw an amazing thing. Beautiful world, beautiful country, beautiful soil, beautiful climate. Everything a human being needs to live a healthy, happy, peaceful, and prosperous life. Everything was there. And yet, abject poverty. So much that 4 or 5 of us who were there, I saw some of our friends literally crying to see that poverty. Yeah. That gave us some idea, especially to me, that whatever we have been doing before definitely made some impact, but not in grassroots level. There are lots of NGOs, lots of organizations, governmental programs, all trying their best to do whatever seems to be appropriate. But sustainability is not there. That was exactly the case in Uganda. I had heard before reaching Uganda that Gates Foundation was doing a tremendous job in the field of HIV and AIDS. And what we saw at the ground level, it was just absolutely pathetic and very, very humiliating to our soul, the spirit of human beings. God bless these wonderful souls like Bill Gates and those people. And yet, when we look at what is happening in real life of human beings, story is totally different. And I will skip many years from there. Then I will tell you something. When we went to Cameroon, it was August of 2006. People were very bizarre. They were looking at it as though if we were just bizarre creatures. I wondered why. First time I heard a word, suitcase NGOs, briefcase NGOs.
Yeah.
People go to these countries, these communities, these societies. They make some promise, they give some money, they start a project. Everybody becomes excited. And next year, all those projects, they just vanish. Such people, such organizations, such individuals, such loving and caring people in African countries, countries in Southeast Asia and in South America, they are called suitcase NGOs. They have their papers, they have some money, they have their camera, and the nice, wonderful reports to their donors. Fine. We have seen what poverty can do. No? Today, you go on Google or many other sources, you will find over 300 million children are suffering from malnutrition related diseases. There are that many children, their physical and mental growth is affected by malnutrition. How many hundred million, how many 100 million, or maybe even many billion people, they are really suffering.
Yeah.
So I will tell you something which sounds very blunt, but that's what I had heard. And I have read in the scriptures, and I have heard from sadhus, the gentle, loving, kind souls. One day, a sadhu in one of the Kumbh Mela told me, do you know what a living being has and what a dead being has? Dead person has? It was a very puzzling question. He said, a dead person does not have any sensitivity to pain and sorrow because he's dead. A dead person does not have any sensitivity to honor and insult. A dead person does not know the difference between kindness and cruelty, love and hatred. I did not understand what it meant. Now I'll give you another example. We started our project in Cameroon. Last 7-8 years, Cameroon has been going through civil war, and the impact became even more intense when COVID-19 came. People literally are carrying guns, fighting there, and yet there has been an amazing demonstration of human spirit. If we make a concerted effort, that spirit doesn't die even in the midst of such tremendous social unrest. And what is that? People at some point come to realize that you are engaged in real day-to-day kind of problems and you are trying to come up with solution.
Yeah.
So what we did in Cameroon, West Africa, we created a system whereby people not only learn how to take care of their farmland, how to take care of their food. It's not only just we shared knowledge, we also shared tools and means. Institute, in partnership with another organization which you may have heard called Mocha Origins, have access to large tract of land. So we opened our farmland to the local people. We had literally tens of thousands of bunches of plantain. That is their staple diet. Amazing kind of banana, which in America you don't see. We had that. We just allowed people started doing farming, and both factions, fighting groups, the army people as well as the local people, they made a rule that within 200 meters of the Himalayan Institute campus, no guns. And we did not ask for that. they realized that no matter, you cannot even maintain your animosity with unless you are well fed. You cannot do anything good or bad if you are hungry and dying and starving. So this is something very real, very real. So being able to implement your education system, for example, what you need is, you need children to come to school with breakfast in their tummy, with food in their tummy. If they have not gotten breakfast at their home, then if there is food available in the school itself, they will study. They will have, it is not very lofty idea to have food as an incentive for children to study in the school, and yet it is a reality.
It is.
There are lots of places in the world. So therefore we realized that we don't need to keep changing our humanitarian agenda, that this year we are doing public health related thing, next year we are doing food related thing, next year we are doing something with the, related to women's empowerment, then next year we are doing something environmental thing, next year then we are planting trees. We do not need to impress our friends and loving and kind people that we are such a grand organization that which is involved into this year this thing, that year that thing. No, what it needs to is, it has to be sustained project. Yeah. Sustainability is very important. Nothing gets done just in 1 year time, 2 years time. If it's 50-year-old, 100-year-old, 200-year-old poverty, frustration, disappointment, oppression, please give 5-10 years to reverse it, That is the whole
No, it's so true. And that's an important part of the story that might not be immediately obvious, that the Institute's work in Cameroon started in 2007. And it has had that central theme consistent from 2007 all the way here. Now we're entering 2025. This idea of an integrated vision for health, children's education, and vocational training. So how we can create livelihood, how we can support literacy and children's education, and the fundamentals of health education, of community health. So this is how the Institute's work has been going on for many decades. And, it's wonderful that there's a core foundation and then room for innovation within that core base. So that's exactly how this food security and community health undertaking emerged. It was a real extension of what we've already been working with for 15 years. About 2 years ago, two or 3 years ago now, just after COVID, and then when a lot of the geopolitical conflict in Ukraine and just overall supply chain issues were really becoming a global problem, the food security issue hit Africa and specifically Cameroon very hard. And it was abundantly clear that there was a need, but rather than simply just trying to figure out a short-term solution and just start doing something for the sake of doing it, we reflected on how the communities that we were already working with in all of the different health and education offerings that we've been doing for over 15 years at that point, how they were being impacted. What was their daily life like? So one of the other beautiful things about the HI Cameroon Center and project, it's fully led by our local Cameroonian team. We haven't even been able to be on the ground for the last several years because of the social unrest. But long before that was the case, actually within 3 years of the establishment of HI Cameroon, the center was completely run
by local people,
by our local team, all the way from the management to the program level to all of the day-to-day activities. So it's a team of dozens of people working. So they were able to share with us what was happening on the ground. And what became clear is that, yes, there is near-term need. Hunger, which had, prior to that point, not been a major issue, was making a major kind of return. It's very disappointing to see. We'd already been working with schools for many, many years as part of our public health outreach, part of our literacy efforts. The schools work in tandem with our libraries for children's literacy. And we had these relationships.
Right.
And your point about how important it is for children to be well fed seems like common sense. Of course, it's an issue globally, whether it's America, other first world countries, or Africa. But that was the starting point of a dialogue that we're already working with a number of schools in this whole region, bringing literacy efforts and public health efforts. We partnered with those schools to bring crucially needed food supplies for children and their families, and then worked with those same schools to deepen what we were already looking at for public health education for community health. And that sparked a beautiful partnership. I think the part that's really speaks to the Institute's vision of sustainability that you just said was, it's not just about buying whatever food or importing food to meet this hunger issue in the schools. What really sparked the deeper thought process is, why is there food shortage?
Yeah.
What does that, what are the underlying issues? And of course, Africa as a continent, there's no reason for it to have food shortages given its extraordinary abundance
of quality of
climate,
soil and climate,
water, and human power. And yet there's a knowledge gap, there's a market gap, and often the willpower or the putting all the pieces together, I should say, there's some kind of disconnection. So we'd already been working in these communities with farmers, with a number of different stakeholders. And in collaboration with Mocha Origins and other local farming cooperatives, farming groups, we were able to see where those different resources that weren't being brought together, where they were, and work with local farming groups to actually cultivate corn, beans, vegetables, all of which are staple food items. Potatoes, greens, jama, right? So huckleberry leaf, pumpkin, and take those food resources and then connect them, bring them to the people who needed them. So working with local farming groups to empower them with resources, whether it's seeds, funding, logistics, so that they can grow food locally and then bring that food to families who need it, and integrate the food security with nutritional wellness and community health. One of the things that's so fascinating is that it's not just about access to food, but it's about ensuring that we're healthy enough to assimilate all of the nutrients and benefits of that. So it's a much more holistic understanding. And that's what's so inspiring. It's not just trying to put a Band-Aid on a problem, but work with families and communities to reflect on how can we not only grow our food, but how can we eat it and digest it in a manner that keeps us healthy? How can we think about hygiene and sanitation, maternal health, so many things that tie in.
That's right. No, I remember when we were starting our Total Health Revolution department. So we did survey and we discovered something so bizarre. We were just totally puzzled to find out that the more people die in Cameroon, not from malaria, not for HIV and AIDS, but guess what? More people die from hemorrhoid.
It's hard to imagine.
Hard to imagine. Find out why. After good amount of research, we concluded that it is the kind of continuously they eat just the starchy food, and there's no fiber. Whereas they have everything available. It's just a matter of training them. And so these are the kinds of practical things, and you come to realize what is really most important. Normally, generally important or less important only when you work in the field, only when you work with people and you gain the experience. So our 17, 18 years of work in Cameroon really has taught us what is really the problem there. And really problem is access to food, knowledge that tells us how to eat, how to digest, and what, and how to, trade among each other, connectivity from farm all the way to those farmers and then those who are not farming communities, everything together, that all that makes, real complete sense.
And it's part of a bigger mission, so food security on its own and distribution of food resources is not the primary mission of HI Cameroon, for instance, and yet it fits in very perfectly because it's a vehicle to work with the underlying desire to support education, health, and that livelihood development, things which can bring a wealth creation from the grassroots that can bring communities together and spark long-term change. And just about a month ago, Jeff Abella, our director of our humanitarian projects, visited our team on ground. So I mentioned that the country still is having some instability, but the region around the capital was fine to visit.
Yeah.
So Jeff took a trip, and we invited our whole HI Cameroon team for a, you might call it like a working summit, everyone coming together to really share experiences of how the projects have been unfolding, areas that are working well, areas that need attention and refinement, what their real feedback was. Yeah. So it was a wonderful opportunity to hear directly from about a dozen key team members that represented all the different departments: our carpentry construction school, our women's empowerment program, our education and children's literacy coordinator, our total health coordinator, everyone, all the way down to some of our staff members who are working as guards and drivers, people who are supporting a number of different activities, to hear not just their view about our programs, but more importantly, what is life like?
Yeah.
What are we know? And we do this regularly, of course, virtually, but meeting with people, going to see everyone, really adds a whole other level of depth. And, those conversations were very enlightening. Yeah. And one of the conversations was about the 2025 campaign that we're about to launch, about whether or not we should refocus our efforts, or this particular campaign, again, just in more of our educational work, or is there still a role for community health and food security? And overwhelmingly, what they said is that this is important work, that it supports the core of what we're doing in the long run with education and health, and yet it's a crucial near-term need. And it's a vehicle to reach families where they're at right now. And it's been very, very well received. It's also been intriguing to see how inspired the farming communities have been. Communities that we might already be working with as part of the Mocha Origins project of coffee and cacao. And as you mentioned, there's a whole food crop cultivation aspect of that same farm for local needs. Engaging with those communities, there was land which had been left fallow for rice cultivation for decades. You remember this exact place. When we first visited this farm, this is probably in 2015 now, almost 10 years ago. It's hard to imagine. A beautiful tract of land. And for any of you who've seen rice cultivation in Asia or Africa or Central America, you can recognize, of course, the land is very flat. It's usually flood irrigated. And what look like small clumps of grass are transplanted. And you can see the remnants of how that kind of cultivation is done. So it was very clear to us that this land had been used for rice. And we asked the farming communities there 10 years ago, do you still cultivate rice?
No.
And they not only said no, as we inquired, we found that Cameroon now was a net importer of rice, even though it's a staple food. And it was just shocking to us that they had left that behind. Again, knowledge gap. The country was flooded with cheap imported food. Many, many different socioeconomic, sociopolitical reasons behind this. But the bottom line was the food insecurity that we're seeing today really had its roots much longer ago. So when we had this desire to really rekindle our work with food security and bring those food resources back to the communities that we work with in education and health, we talked to the areas where rice had once been cultivated. And we asked them, if we make this land available to you and help bring the resources to begin cultivation of rice again, will you do it? And they were very, very excited and empowered. So last year, we had our first harvest of rice from that region that they've had in many, many, many years. And we want to continue that. So it's a beautiful story of something where people are actually gaining livelihood, they're regaining skills, and those critically needed resources are being brought to bear, not just in a general way, but what better feeling is there than making sure that children and families are well fed, and specifically linking that to their ability to study well at school and bring that community health knowledge back to their families. So this virtuous cycle is so beautifully and wisely woven together. It just was a project that when we talked to our team again, when Jeff was just there recently, it was a overwhelming 2 thumbs or all thumbs up kind of thing that please let's continue. There's still need while we ensure that our core focus of education and health is enriched by this, not replaced by it.
That's right. That's right. That's right. Yeah. No, this is very practical approach, and this kind of practical approach is grounded in our own personal experience. We have been seeing it in Cameroon. We have been seeing it in many, many other countries. And ultimately, unless a project is properly planned and executed, and unless there is sustainability in it, we do not see a lasting impact.
Yeah.
So that's very important to remember.
It is. And that's our passion. Yeah. And I think as a community, that's what we're looking to do. We want to make long-term positive change in our own lives as yogis and meditators, as seekers of change, but we want to ensure that that also happens in the world around us.
Yes.
And so this is our great passion, and it's a privilege to invite you to join this project to support our 2025 Food Security and Community Health Fund. And please donate to this project, support it, be part of it ideologically and as a supporter. It really makes a big difference, and it's a project that we really believe in. And on behalf of the communities in Africa, I can say how meaningful it is and how big of a difference it is.
And my personal commitment is I will do more meditation, more prayer, and I will send you more and more and more love, prayer, and blessings. I know how kind you are. Thank you, thank you, thank you. God bless you all.
Please learn more online and join.